Hi, my name's Carol Timmings, and I'm Senior Nursing Leader with Toronto Public Health, and I'm very pleased to have the opportunity to speak with you about Toronto Public Health as a best practice spotlight organization. Best practice guidelines are evidence-informed guidelines that are integrated into our practice to positively influence client outcomes. When Toronto Public Health was considering becoming a best practice spotlight organization, we needed to consider the fit of this initiative with our overall strategic plan. It was determined that these guidelines fit beautifully with two key directions in our strategic plan. The first direction is embracing excellence in and being a leader in urban public health practice. Because in leading in public health practice, it is very important that we use evidence-informed practice to ensure that our approach and interventions with our client are achieving the best possible outcomes. It also fit beautifully with being a healthy workplace that embraces excellence and promotes collaboration and mutual respect. In that strategic direction, being a learning organization is one that does embrace inquiry, does embrace excellence, and does embrace evidence-informed practice. And these guidelines aligned beautifully with that as we looked at incorporating evidence into 5 key areas within the organization. In implementing these guidelines, we are finding that staff are embracing this opportunity to ensure that the practice and approaches we take with clients and the community are incorporating the best possible evidence. And we know through the literature that this will in fact improve our client outcome.
The 5 best practice guidelines are women's abuse, BPG, primary prevention for childhood obesity, enhancing healthy adolescence, interventions for postpartum depression, and finally, integrating smoking cessation in daily practice BPG.
Being involved in the best practice guideline for healthy adolescent has helped Toronto Public Health increase the momentum around how we coordinate, collaborate, share information around best practices related to youth engagement. And we look forward to continuing to learn and to share information and to look for opportunities for synergy and to decrease any of the duplication and to create some mechanisms for staff communication and staff sharing of information so that our staff continue to develop and increase their capacity to most effectively engage youth in their work with Toronto Public Health.
Part of being a healthy organization and a workplace that's leading in public health practice means being a learning organization. And a learning organization is one that embraces not only evidence and excellence in practice, but also looks at how we integrate that across a multidisciplinary workplace. And the beauty of these best practice guidelines is that they are actually being implemented across a number of directorates within Toronto Public Health. And many of these best practice guidelines are contributing to knowledge transfer and looking at how we actually incorporate new evidence into existing practice.
Knowledge translation is not just a communication problem. If it was that simple, we'd simply send an email. The Champion model has been shown in the literature to be an effective method of knowledge translation.
We also are very delighted to have 90 champions to engage in this initiative. For all the champions, we developed a storytelling training plan for them.
Being the smoking cessation champion, responsible for the West End, I was asked to present the information that I had received from the RNA workshop and any updates I had received afterwards. I decided to come up with a package to give to all the attendees, which will include the PowerPoint presentation, resources, contact info, and some key messages that they all need to do this. But luckily, I had students at the time. I made one model for the package and I gave it to them with all the information. I told them make me 30 copies of this same package, and that was done.
The support from the Registered Nurses Association of Ontario has been extensive in the knowledge development area, not only from the use of the research symposiums, but also best practice summer institutes, advanced clinical practice fellowships, and meetings with other best practice spotlight organization candidates and organizations for knowledge sharing.
A best practice guideline implementation fellowship focuses on the development of skills and knowledge on activities related to program planning and knowledge uptake and transfer. I can say that I'm very satisfied with what I was able to accomplish, and I do feel more confident in my nursing skills.
I'm so pleased and extremely proud to be opening this BPSO symposium. These are the highlights of our work here at RNAO, certainly a highlight for me.
With that, I want to simply say, on behalf of the nursing community, and yes, on behalf of the province of Ontario and beyond, thank you.
This is all about protecting and improving our wonderful, world-respected healthcare organization. One of the ways we're going to be able to pass on the gift of universal health care, even better than it was, is by increasingly focusing on evidence. We simply must make sure we're using those dollars to provide the best possible outcomes for patients. That's what it's all about. RNAO and the best practice guidelines and best practice organizations are leading the way when it comes to understanding the evidence, translating that evidence into useful information to improve care for people. I cannot thank you enough for the work that you have done for the people of Ontario, for the strength of our healthcare system. I am just enormously proud of the contribution you are making, so thank you so very, very much.
The best part of Toronto Public Health being a best practice spotlight candidate organization is what it has done already for the culture of Toronto Public Health. This initiative has been one of transformation. It has enriched our practice environment. Staff feel that they are encouraged to do the very best they can as they integrate best practice guidelines into their daily practice. This has really been an encouragement for them to continue to strive for excellence in practice.